My name is Michael Erickson, and I'm the Dean of the School of Public Health. And it is an incredible pleasure and privilege to be here today celebrating this momentous day in the lives of our Masters of Public Health degree students and their families and friends today. And it's always heartwarming to see the number of students that we graduate, the turnout from our faculty, and particularly the friends and family that are here to share in the accomplishments of our students. This is a very, very special opportunity, and it's a highlight of the academic year for us. I want to make sure that everyone realizes that this is really a lifetime achievement. It's often hard to put a moment in time in perspective, but this is something that all of the students will always remember. This is a very special day. I think all the faculty can remember when they received their graduate degrees and the circumstances and the pain and suffering that led up to it, and the celebration that occurred afterward. So do enjoy the day and the significance of it and the accomplishment associated with it. I hope many of you will consider even further education, much to the dismay of your parents, I'm sure. But the possibilities of, at some point in your careers, returning to the university, pursuing doctoral training, if that's something that fits in with your career plan, and that you consider Georgia State as a place to go. We're very proud of our doctoral program. But if you must, consider another university somewhere, as long as it can give you the type of education and training that you would like to have in your future career endeavors. There really is no better place, in my opinion, in the world for you to pursue your careers in public health than in Atlanta. We are really blessed here to have the institutions that lead public health in this country and around the world located in Atlanta, places like the CDC, the Carter Center, Task Force for Global Health, the American Cancer Society, state and local health departments, many of which are either on campus or within walking distance, and many of you have had your practicum experiences there, are also opportunities for employment. And I know this is great importance to the parents in the room of your investment and your nurturing and what your children do in terms of next stages in their career. I know for myself, I have two college-age young adult children, and my oldest one just started a job in September. And the feeling of relief, first of all, but pride to know that he's gone on from the earliest days to succeeding in college and graduate school and getting employment and starting a job. And it's a great source of reassurance and relief to his parents. And I know that you share that same feeling today, to know that your children have not only excelled in getting their college degrees, many at Georgia State particularly are first-generation college students, but then going on to the next level and getting a master's degree, and then being prepared to launch a career where they will be making a difference in people's lives is very inspiring and very noteworthy. I'd like to just say a word about the institution from which they're graduating, Georgia State University, and just a word about the School of Public Health, so you have some context and I think can share the pride that we have as faculty and students. Georgia State University really, and I've been here for 15 years, and never has it received the accolades and acclaim that it has received recently and continues to receive. It's recognized nationally as one of the most innovative universities in the country. It's considered to be the fourth most innovative in undergraduate education. It's the largest university in the state of Georgia. It's one of the top 12 largest universities in the United States. Most of this is due to the consolidation with Perimeter College that's occurred over the last few years. So now there are over 50,000 students at Georgia State University. So it's being recognized for its accomplishments. It's large. It's really focused on bringing students from post-secondary education, whether it's into the perimeter, into the associate degree program, into the baccalaureate program, and then into graduate education based on the needs and aspirations of students. And people around the country are looking at Georgia State in terms of its success in this endeavor. In addition, Georgia State graduates more African American students at the undergraduate level, at the bachelor's level, than any other university in the country, except for some for-profit universities that are basically online entities. But there's nowhere in America, including historically black colleges and universities, that graduate more African Americans than Georgia State. And our graduates all graduate with the same level of success. It's one of the few places in the country that students graduate, whether they're African American or Hispanic or Asian or white or rich or poor, all graduate at the same level. So the university has done an incredible job in graduating students in less time, at less money, and putting them on careers for success. And we're extremely proud of that. Not all of the accomplishments for the university have been academic, though. As you know, I'm required to say that tomorrow Georgia State's playing in the bowl game, the football team, in Orlando, the second time that it will be in a bowl game. So, and over this year, while you're a student, your children have been here graduating, we occupy Turner Field. It's now Georgia State Stadium. Football games have been played there for the first time in history. So there's a lot going on at Georgia State, and the future continues to be great. In terms of the School of Public Health itself, we have had another great year. We set records in terms of research dollars and credit hour generation, and we're widely recognized around the university as being a model of success. We started our new undergraduate program that we still yet have had a graduate from, but we're looking forward with great excitement to that program. We have one of the things about our program here at Georgia State, we have the largest proportion of African American MPH students of any school of public health in the country. And we're quite proud of that fact. And the public health workforce really needs great diversity, and we feel that we're not only providing the right graduates for the public health workforce, but being in Atlanta with CDC, which is the largest employer of public health people in the world, it's a great match and a great opportunity. So we have a lot to be very proud of today in terms of the institution, and particularly of the young people, I can say without hesitation, in front of us who've persevered, demonstrated great tenacity and hard work, and that this is, not everyone is starting their career today. Many of you have worked in public health and have returning, but this is really launching you on a new dimension and a new trajectory in terms of your career, and we're extremely proud of you. We welcome you to the ranks of our alumni, and I think that you'll see that there's a family of alumni from the School of Public Health at Georgia State University that supports one another, that shares, that mentors, and that we will expect the same from you when you get out into practice. So without further ado, I'd like to turn it over to the Associate Dean for Academic Affairs, Dr. Rodney Lin, to carry on with the program. Thank you.
Thanks, Dean Erickson. It's my pleasure to introduce this morning our student speaker. Michelle Livings is graduating from the MPH program with a concentration in biostatistics and a 4.0 GPA. Her thesis is titled Maternal Preconception, Health and Neighborhood Factors in Relation to Preterm Birth in Georgia, 2012 to 2014. Throughout her program, she served as a graduate research assistant under Dr. Betty Lai, where she helped to validate a screening tool for child sex trafficking. Michelle has completed her practicum in chronic disease, healthy behaviors and injury epidemiology at the Georgia Department of Public Health, where she performed an analysis of the Georgia Violent Deaths Reporting System. She's currently working as an epidemiologist at the Georgia Department of Public Health. Her future goals include earning a doctoral degree and becoming a college professor. So please welcome her to the microphone.
Thank you, Dr. Lynn. Good morning, everyone. I'm so honored to be speaking to you today, and I'm honored to be graduating with such an extraordinary, brilliant, and talented group of individuals. I've taken a winding road to get to this point, as I'm sure many of us have, and I'd like to tell you about my journey and talk to you about passion and opportunity this morning. Before coming to the Georgia State University School of Public Health, I had lived my whole life in New Jersey. I studied chemistry in undergrad, completed 2 years in a chemistry Ph.D. program, and then taught high school chemistry for a year, during which time I realized that chemistry was not my calling. I then spent 3 years working at random places, including Nordstrom, Qdoba, 2 casinos in Atlantic City, and Kaplan Test Prep. I got my EMT certification. I completed all the prerequisites for nursing school. I actually got hired as a transport EMT. And on my second day of training as a transport EMT, I was in a wound care visit with a patient. I fainted and hit my head on the wall and got a concussion, which led me to the conclusion that medicine and nursing school in particular was not my calling. I then met with an Air Force recruiter. There's some Air Force members in my family. I met with an Air Force recruiter about officer training school. I was told that I was automatically disqualified because I have a tattoo above the level of my collarbones on the back of my neck. The recruiter suggested, he said he could not technically suggest, but that I may consider having it laser removed to be eligible for active duty. But it's my favorite tattoo, so I concluded that the Air Force was not my calling. Finally, in August 2015, I decided that I needed to go back to school. I researched public health careers, and while I didn't really have a firm grasp of what people in public health actually did, I thought it made sense, given my background, to try to stay within the realm of medicine and health. So I applied to 7 public health programs that accepted students for spring admission, and ultimately made the decision to move from New Jersey to Atlanta. Last summer, multiple family health problems arose. I was 12 hours away from my family and unable to get home. And over the past year and a half, I've lived with a lot of guilt and grief and many borderline regrets. But I'm thankful to my family for being completely supportive and encouraging of my attending school and building my life here in Georgia. I've earned this master's degree for both of my grandmothers and for my parents. Thank you, guys. I've had so many opportunities at Georgia State that I know I made the right decision in moving here. I'm beyond fortunate to have spent almost 2 years as Dr. Betty Lai's graduate research assistant, and during this time, I've had hands-on experience with every aspect of research and publication. I was able to study abroad in Brazil last year, an experience that has shaped the way I think about public health, research, and also family. I've taken classes outside of public health, purely out of interest and curiosity, which is how I met several other mentors at Georgia State in the School of Policy Studies, the Urban Studies Institute, and the College of Education, all of whom have helped me to further develop as a researcher. I completed my practicum with Michael Bryan at the Georgia Department of Public Health, which has led me to a job with the Georgia Department of Public Health, specifically the Georgia Pregnancy Risk Assessment Monitoring System, or PRAMS for short, in the Maternal and Child Health Epidemiology Unit. Through opportunities that I've had at Georgia State, I've discovered a passion for maps and spatial analysis and also health disparities. And in my current position with Georgia PRAMS, I'm performing statistical analyses to investigate disparities among recent mothers in different sociodemographic groups. I'm submitting abstracts with the goal of presenting my work at various conferences. I'm doing background research for a spatial analysis that I hope to write up as a manuscript for publication. I never pictured myself working in maternal and child health, but I grabbed an opportunity that was offered to me, and in my position, I'm able to incorporate all of my passions and to conduct original, meaningful research. I'm fortunate to have a job that I love leaving this program, and I'm excited for what lies ahead. And I hope each of you are equally excited for your own careers and futures. So I've told you about my background and experience this morning to stress to you that opportunities may come in unexpected packages. An opportunity that you may not think, or that you may think may not be a good fit for you based on your experience, interests, and goals, may help you to discover an unexpected passion for something new, or may eventually lead to your dream job. Any opportunity could be the opportunity that you want or need. Keep an open mind. I remember 2 takeaways from our MPH program orientation. The first takeaway is that biostatistics is sexy. Thank you, Dr. Mason. The second takeaway, and in my opinion, one of the most impactful things that has been repeated and reinforced throughout this program, is the importance of networking. During our orientation, practically every topic that was discussed eventually came back to networking. I consider myself a forced extrovert, meaning I am an introvert by choice and an extrovert by necessity. And I remember thinking multiple times during orientation that I could be successful without networking. I've always managed to get a job or to get into a program, but over the course of this program, while I've been learning what public health professionals actually do and discovering that public health encompasses everything, I've discovered the importance of building and sustaining a network. Public health can be local at the town or county level. Public health can be very specialized, such as identifying and assisting select individuals who have contracted a rare infectious disease. Public health can be very broad, targeting state or national policies to improve the health and well-being of Georgia or the U.S. as a whole. Regardless of scale, public health encompasses everything, and thus collaboration is necessary between coworkers, between multiple departments or organizations, and even between various fields. Building and sustaining a strong network will not only yield opportunities on a professional or even personal level. Building and sustaining a strong network will ease collaboration and will make collaboration more productive, enjoyable, and even fun. I want to thank our School of Public Health faculty and staff and our Office of Academic Assistance for being such a supportive and helpful network while we've worked our way through this MPH program. My fellow graduates, our faculty, staff, and fellow students and alumni from the Georgia State University School of Public Health make up a spectacular network of individuals with varied interests and experiences. Some of the classmates, professors, and staff that we've met in this program will turn out to be our lifelong friends and collaborators, part of our research families. Some of our classmates, professors, and staff that we've met in this program may introduce us to our future mentor, future boss, or even future spouse. And some of the classmates, professors, and staff that we've met in this program may offer us the biggest opportunities of our careers. Any opportunity may be the one that helps you discover your passion or leads to your dream job. Take these opportunities and keep networking. Help other people in your network when you can. Keep in touch with each other. Go to conferences and talks. Meet new people and build new bridges. Introduce your friends and colleagues to each other, and most of all, keep caring about each other and keep encouraging one another. My fellow graduates, it is our time to change the world. We may have varying interests, from chronic or infectious diseases to healthcare policy, from epidemiologic surveillance to program design, from health promotion to statistical analysis, from local public health to global health. Yet we are all public health professionals. Public health encompasses everything. and we all have vital roles to play. Some of us will move on in academia, earn fellowships and additional graduate degrees, become professors and researchers, shape the minds and lives of students, and work with and learn from people around the world. Some of us will work for local or state government offices or for the federal government, and will be an integral part of improving the health and well-being of our friends, our neighbors, our communities, and our country. Some of us will branch out to related fields, such as policy, law, education, biology, psychology, sociology, anthropology, medicine, disaster management, geography, or emergency preparedness. Public health encompasses everything. A large door is opening for all of us today, and the opportunities are endless. Congratulations, Fall 2017 public health graduates.
Michelle, thanks so much for sharing your journey, your story, and the lessons you've learned along the way. Please join me again in thanking Michelle. Next, I have the opportunity to introduce our alumni speaker, and this is someone that's very familiar to many of us. Courtney Jones graduated in 2010 from the MPH program with a specialty track in health promotion and behavior. Her capstone was chaired by Dr. John Lutzker, was titled an Evaluation of Consumer Satisfaction of Safe Care Provider Trainings. For those of you that aren't familiar, Safe Care is an evidence-based home visitation curriculum shown to reduce child maltreatment. She completed her practicum at the Marcus Institute, which is now the Marcus Autism Center. And she worked on the home visiting nurses project for the Georgia Department of Human Services. Today, Courtney is a senior training specialist at the National Safe Care Training and Research Center and the Mark Chaffin Center for Healthy Development here at Georgia State University. She oversees the implementation of safe care in organizations in the U.S. and abroad, providing training, ongoing consultation, project management. Currently, she serves as a member of the School of Public Health Alumni Board. Please join me in welcoming her to the microphone.
Good morning, everyone. This is a really special occasion because it's your commencement. And I feel very honored to be here to mark this day. What I want to do is to really ask you to take a moment today, sometime, to think about all the hard work, all of the long nights, all of the papers, all of the research, all of the stress and the worry and anxiety, and that you have come to the point where you did it. You did it. And I'm proud of you, but I really hope that you take a moment to be proud of yourself. This is an accomplishment, and I really want you to take that time to pat yourself on the back and to give your family and friends and your colleagues and your classmates an opportunity to pat you on the back. Not everyone does this, but you did it. And I'm really excited to be here today to mark this moment. I don't want to be long. I want to say one thing, that being a public health professional, this work is hard and it's humbling, but this is honorable work. And I'm so fortunate that you have joined us in this charge to help people live their best lives. So this work may be hard, and I don't say that to scare you away. I say it as anything that you think is important and is worthwhile doing is going to be difficult. Your statistical analysis is not going to work out. The evaluation that you do is going to end, and you're going to see that's not what we thought was going to happen. And that's okay. This is hard. You might have a failure. You might not have something work out the way you planned, but I want to encourage you to keep going. This work is humbling because we are doing the work that helps people live better lives. That's my goal, and I hope that will be your goal in whatever you choose to do with your public health career. We're here together. This work isn't something you can do alone. Your classmate, Michelle, talked about networking. You are a part of the network, and you are a part of how we make success move forward. So it's humbling, and it's hard, but it's honorable. I can't imagine doing something else with my life than to help family and children. I didn't know that's what I wanted to do when I was 5, when I was 15, when I was 25, even when I was 35, which I'm doing the same work I'm doing now. But it's something every day that I get up and I have the pleasure of doing, that the work that I do, my career, makes a difference in other people's lives. When I tell people what I do, they want to know, how did you do that? What made you think you wanted to get into that role? And it's a winding road, like Michelle said. I didn't start out thinking that this is what I wanted to do, but I can't imagine doing something else. And that is a great feeling, to wake up every day feeling that way. And I really hope that you all will have that experience in your careers. So again, this work may be hard and it may be humbling, but this is honorable work. And we welcome you into the public health community, into the Georgia State Alumni Network, into the Georgia State family. You can't get rid of us. We'll always be there for you. And we hope that you'll be there for us. We hope you'll be there for your colleagues that are coming through the ranks behind you. We hope you'll be there for when we reach out to you as the Alumni Board and ask you to come and speak, come and participate in our programming. We hope you'll step up to the plate and continue to do this honorable work. So again, thank you for letting me be here to speak to you on this day. I appreciate seeing your faces. I appreciate being here to be able to say congratulations and welcome.
Well, first of all, thank you, Michelle and Courtney, and I think you can see the quality of our students and their ability and their accomplishments as evidenced by the words from Michelle and Courtney. So thank you again very much. Now, this is the fun part of the day, and I'm going to ask all the graduates to please stand. This is a special opportunity for me because the bestowing of the degree is normally reserved for the president of the university, but because of the way commencement is handled this year, the president only confers degrees to the undergraduate students and the deans confer to the graduate students. So this is a great pleasure for me to have this opportunity. So by virtue of the authority delegated to me by the president of Georgia State University and the authority vested in the president by the Board of Regents of the University System of Georgia, I hereby confer upon you and each of you the degree described in the official records of these commencement proceedings with all the rights, privileges, and responsibilities thereunto appertaining. With this, please move the tassel from the right part of your cap to the left, indicating your accomplishment and conferring of the degree of Master of Public Health. Congratulations. Denise?
Good morning, everyone. I'd like to take this time to congratulate our graduates. It's always a pleasure to meet you when you're coming in the door and to see you successfully complete the program. This is truly a happy day for us and for you and for your family and friends and everyone that supports you as you go through our program. And so now, this is the time that we will individually recognize each and every one of you. I will ask you to see Gina, and we can. Adewole Adetukun. Lena Amanti. Rebecca Ament. Ashley Campbell. Robin Kathy. Chelsea Keller. Nikita Kinney. Michelle Livings. Jasmine Mullen. Sterner Samila. Aditiben Patel. Vaishnavi Patibiraman. I got you. Sashoy Patterson. Torianne Percy. Emily Sina. Ariel Shiver. Fiona Becker. Elena Wilder. Let's all stand and congratulate our graduates.
Great, everybody can be seated, please. Again, this is, as I said at the beginning, this is a day that everyone will remember in terms of a significant life event. And, you know, it's not quite the birth of a child, or a marriage, but it is something that is very significant and will be remembered forever. And it is earned. It is not given away. But everybody here today worked extremely hard and persevered and demonstrated tenacity to accomplish this achievement. And it's something no one will take from you. It will be something you can be proud of for the rest of your life. And as Courtney said, as an alumni, the value of the family of graduates, we have over 600 now working around the world, particularly in Atlanta, our network, as Michelle said, that you should draw upon. It can help you in career development and problem solving and opportunities. So it's a very special day and special occasion. But I do want to say a couple words just to put it in perspective. First of all, you know, this is a privilege for me to stand here before you and to talk to you and to help you embark on your careers. And I'm giving that privilege but it's not my work. It's the work of the people in the audience. Particularly like to recognize the School of Public Health faculty and staff who, without their hard work every day and their responsibilities, whether it's around teaching or advisement or research or mentoring, or just everyday administrative work, none of this would have happened. So please, the faculty and staff, please stand and accept our appreciation. Thank you. We have a very humble group, but a very special group, and I think the students will all agree with that. And one of the things we pride ourselves in is that the availability and the caring of our faculty and staff to help you be successful both in school as well as afterwards. But really, while the faculty and staff, we get paid. This is our job. This is our job, is to help you be successful. We get, I can't say get paid handsomely, but we do get paid for this. The people who don't get paid are the ones I'd like to acknowledge now, and they're the people who actually are really responsible for your success today, and that's the people sitting behind you. These are your parents and your children and your friends and your partners. So graduates, please take this opportunity to thank those who made it possible for you to be here today. So with that, I'd like to again conclude the graduation ceremony. I want to thank all of the faculty and staff of the university, the families and friends and children and partners of the graduates, and particularly congratulate graduates for your accomplishment, your hard work, and wishing you the best of luck and fortune as you go forward and making a difference in people's lives. And this is what I think hope you've learned in the time that you've been here and heard today from Michelle and Courtney, is that public health makes a difference. And it makes a difference in people's lives that often need it the most or cared about the least. But there's the greatest opportunity for improvement and benefit, because if we don't do our job, people suffer. People die prematurely, and prevention never occurs. And we're the forefront of efforts to make a difference in people's lives. So always hold that close to you, hold it in your hearts, and go forward and make a difference in people's lives. So thank you very much.